Okay, what is a connective tissue? All connective tissues develop from mesoderm. That's in contrast to epithelial, which actually develop from both ecto, meso, and endoderm. Number 2, connective tissues consist of cells and intercellular matter secreted by the cells. You say, what does that mean? In a connective tissue, the cells are not packed closely together. They are actually separated apart. And these cells manufacture and secrete proteins that are secreted into the spaces between the cells. And so this protein, this matter that is found between the cells is called intercellular matter. What does inter mean? Between. So between the cells, there's this material. There's proteins. Proteins that are manufactured and secreted by the cells. Another characteristic of connective tissues is that in general, with only one exception that we'll get to, they are highly vascularized. They all have lots of blood vessels. That was in contrast to epithelial tissues, which have no blood vessels. Generally, connective tissues are called connective tissues because they act to connect and hold all the other parts of the body together. So now we're going to go through some connective tissues. Now, how do we categorize connective tissue? So we actually classify connective tissues based on, number 1, the type of cells, and number 2, the type of intercellular matter between the cells. So now we're going to give you some examples of different connective tissues, just like we did with different types of epithelial tissues. Now, the first connective tissue is called a relar connective tissue or loose connective tissue, either term. And you need to know about it, and you need to recognize it under a microscope. This is a really important tissue. It is the most pervasive tissue in the body. It's found everywhere in the body, everywhere in the body. It's really holding everything else together. The major cells, most of the cells that are in this tissue are called fibroblasts. They're called fibroblasts. That's the principal or major type of cell. It is the fibroblasts that manufacture and secrete the proteins into the spaces between the cells. Now, when I say they secrete proteins, let's talk about what proteins they secrete. Look on page D10. And on page D10, so on D10, we wrote that on D10, so there's these proteins that are secreted by the fibroblasts. They are 2 major types. There is collagen protein, which is very strong, and there is a kind of wiry, thin protein called elastin, which, as its name kind of implies, it's kind of flexible or elastic in nature. So these are the 2 proteins that are manufactured and secreted by the fibroblasts. I've also, and we wrote that right here, these proteins are secreted by the fibroblasts. And we wrote that the areolar connective tissue that we're speaking of is the most widely distributed tissue in the body. It's everywhere. All right, so now back on page D8. Back on page D8, in addition to fibroblasts, there's also macrophages and mast cells. Now, just before I explain macrophages and mast cells and so on, you might say, do you have a picture of this? Yeah, if you look on D9, on the lower left on page D9, it shows this tissue. But you've got really a much, much better picture of this than what I show on D9. If you look in your lab manual, in exercise 5, no matter what edition, it's probably figure 5.4. Figure 5.4. This is a drawing of what we find in this tissue. All right, they drew it slightly different in the 2 editions, but it's basically the same. whether we're looking at this, we see fibroblasts, collagen, elastin, mast cells, macrophages. In this one, the newer edition, they actually made it a little simpler. Macrophages, fibroblasts, mast cells, and collagen, and collagen up here, and elastin. When you look at it under the microscope, it's going to look absolutely identical to figure, let's see, in the 6th edition I have, it's on the top of page 64. It's labeled on page 64 in the 6th edition. It's labeled at the top, connective tissue, proper loose connective tissue, or reeler. In the 4th edition, it's on page 49. Looks the same. That's what it's going to look like. It looks really absolutely identical to this. Just looking at this picture, what it's showing you is that there are some purple stained cells. They've been artificially colored or dyed purple. Those are mostly fibroblasts. You're going to see some red collagen. The collagen is not really red in color. It's been dyed red. And you're going to see some thin squiggly black lines. That's the thin squiggly elastin protein. So you should be able to recognize when you look through the microscope, the purple cells are mostly fibroblasts. The thick red protein between the cells is collagen. And the thin black lines is the flexible elastic elastin protein. Back on page D8, we're talking about what's called a reeler connective tissue or loose connective tissue. Either term is okay. It is the most pervasive tissue in the body. What are most of the cells? They're called fibroblasts. They've been artificially dyed purple. They're not really purple. We don't have purple cells. What do these fibroblasts do? They secrete proteins. What are the two proteins they secrete? They were the ones listed on D10. Collagen and elastin. What's collagen all about? Strength. What's elastin about? Elasticity, flexibility. So this tissue is both strong and flexible. Now, there are some other cells in this tissue. You don't have to recognize these cells. They're just going to appear purple also, just like the fibroblasts, but you should know about them. There are macrophages. The word macrophage literally means big eater. Big eater. Macro is big, phage, phagocyte, phagocytosis means to eat. These are large cells that swallow up foreign agents, swallow up bacteria, swallow up viruses, and so on. There are also mast cells. You'd say, what are those? You should know that mast cells produce and secrete a chemical called histamine, and other chemicals as well. Now, histamine is one of many chemicals that are commonly called chemical mediators of inflammation. They are involved in inflammation. Now, most of us have not heard of histamine before, but we have heard of drugs, medicines that people take called antihistamines. Obviously, an antihistamine drug counteracts histamine. But what does histamine do? And when do mast cells release histamine? So we wrote that any injury to any part of your body causes the mast cells in this tissue, which is everywhere in your body, to release histamine and other chemicals. Histamine causes inflammation. One of the things that histamine does is it causes local dilation of the blood vessels in the injured area. You'd say, what's dilation? Dilation means the vessel gets wider. Right? It goes from being like this to like this. So when the vessel dilates, that increases the flow of blood through this dilated vessel. And as more red blood, as more warm red blood flows through the dilated or enlarged vessel, the area that's injured gets all red. And the clinical term for turning red is erythema. What's the clinical term for a red blood cell? Erythrocyte. Erythra means red. So the area gets all red, feels all red, it looks all red, and it's all warm. That's because histamine and other chemicals are causing the vessels in the injured area to dilate. That's increasing the flow of warm red blood into the injured area. Now, you'd say, I don't get any of this. I don't understand what you're talking about. So let me give you an example. Let's imagine that you're hammering a nail, right? And the hammer misses the head of the nail and slams right into your thumb. All right, if the hammer slams into your thumb, have you injured your thumb? Right. This tissue is everywhere in the body, including your thumb. So now you've injured your thumb, the mast cells start releasing histamine, and the histamine causes the vessels in the injured thumb to dilate. Now there's all this increased flow of warm red blood into your thumb, and within a matter of moments, your thumb has turned all red. Feels all warm, and it's turned all red. Now the purpose of this, the purpose of histamine being released in response to injury, is to increase the flow of oxygen and nutrients to the injured area. So it's really a beneficial role. That's why it's happening. It's your own body making this happen, to increase the flow of oxygen and nutrients to the injured thumb. Now, what else does histamine do? Histamine released by these mast cells also causes a local increase in permeability of the blood vessels. It makes these very same blood vessels that not only dilate, but become more leaky. By making the wall of the vessels more leaky, more permeable, proteins and water leak out. Proteins and water leak out of these vessels. And the proteins and water leaking out causes the injured area to become all swollen. We'd say there's localized swelling or localized edema. Edema means swelling. All right, so this is the histamine making the walls of the vessel more permeable, more leaky, so that proteins and water leak out. Now, you'd say, I don't get it. So let's go back to hitting your thumb with a hammer. Right? When you slam the hammer on your thumb, you've injured the thumb. The mast cells release histamine and other chemicals, and they not only make the vessels dilate, causing your thumb to turn all warm and red, but they cause the vessels to become more permeable, more leaky. Proteins and water leak out, and your thumb swells up. Your thumb is all swollen. So it's swollen, and it's red, and it's warm. Now, the purpose of this, of why it's happening, why the histamine is making the walls of the vessels more leaky, is that it allows these proteins to leak out, which will promote healing. Now, another thing that some of these chemicals do is that they stimulate pain fibers. So these chemicals activate the pain fibers. I know you're thinking, well, but you slam the hammer on your thumb, and of course it hurts. No, it's not of course it hurts. If you cut the nerve that goes from your thumb to your brain, would you feel anything? No. In fact, if we put a local anesthetic right in by that nerve, you could hit the thumb with a hammer and you wouldn't even feel it. Isn't that what the dentist does when they create nerve block? You don't feel the drill because they've numbed it. So these chemicals activate those pain fibers, and the signal goes to your brain. So the purpose of the pain is to tell you that you've got an injury. You'd say, well, I would know that. I just slammed the hammer into my thumb. I know I'd injured it. I know. In that case, you could see it. But what if you were walking barefoot, and you stepped barefoot onto a piece of glass? If it didn't hurt, you'd just keep walking, wouldn't you? Because you wouldn't have seen that you stepped on a piece of glass. So the purpose of pain, of the chemicals activating the pain fibers, is to send a signal to your brain to tell you you've hurt yourself. Hey, it hurts. Take a look at it. If your tooth didn't hurt, would you go to the dentist? People only go to the dentist when their tooth hurts. Right? That's the only time anybody ever goes to the dentist. I mean, you'll get your teeth cleaned, but nobody's going to see the dentist unless your teeth hurt. Right? So anyhow, this is among the things that histamine does. So again, slamming the hammer into your thumb causes it to turn all red, feel warm, become all swollen, and hurt like hell. We call this redness and swelling and pain inflammation. That's called inflammation. So any area that's injured becomes inflamed. Red, warm, swollen, and hurts. And here's another example. Another example. Let's say that you've got strep throat. You know what that is? Strep throat is when you have a bacterial infection of your throat. Okay, it's Streptococcus pyogenes. All right, so you have a bacterial infection of the throat. What's the bacteria doing in your throat? It's eating you up. It needs food, you're its meal. All right, so if the bacteria are eating your throat, are they injuring your body? Yes. So these mast cells in your throat, because this tissue is everywhere in the body, start releasing histamine. So your throat gets all red and warm and swollen and hurts. We'd say it's inflamed. That's what inflammation is. Now, if you had, let's say you had a cold is a virus in your nasal passages. So the virus is damaging your cells in your nasal passages, and the injury, the damage is causing mast cells to release histamine, and so all your nasal passages are getting all red and warm, and fluid is leaking out of your bloodstream, so you got swelling and drippy nose and runny nose, and it's stuffed and it's dripping and it's red and it hurts and you got a cold and it's dripping and it's red and it's... So people don't like that. So what do? They take medicines called antihistamines. What do the antihistamines do? They reduce the redness, the swelling, and the pain. Right? So that's why they're taking it.
It's the same for like muscle aches, right?
Yeah, you take it. Again, it doesn't really help anything.
It just makes you feel better.
Makes you feel better. If a virus is causing the cold, taking an antihistamine is not antiviral. If you have a strep throat, you need an antibiotic, not an antihistamine.
So
And if you've hurt your thumb, taking an antihistamine doesn't make it any better. It just needs time to heal. But people take things to make them feel better, to alleviate the symptoms of inflammation. All right, that's an important tissue for the reasons we've been learning about. On page D10, the second connective tissue we want you to know is adipose connective tissue. Adipose is the technical name for fat tissue. And again, I put a star by it. It means you need to know about it and recognize it under the microscope. Frankly, it's really easy to recognize. You've got pictures in your lab manual like this. This is really what it looks like, just like in the lab manual. It's in your lab manual, adipose tissue. At a lower magnification, it looks like a honeycomb. It looks like just a bunch of hollow cells. At higher magnification, we can make out the fat cells, or adipocytes. That's their technical name, adipocytes. And the reason why the cell kind of looks like just a big circle is because there's a very thin rim of cytoplasm and a nucleus, and there's a large vacuole. And that large vacuole is holding fat. So it's a big wad of fat inside a vacuole. Do we know what a vacuole is? It's a sac. We learned about vacuoles and vesicles back in section B, based on the size of the container, the membranous sac. The fat cells do manufacture and secrete a little bit of collagen, so there is a little bit of intercellular matter between the cells containing some collagen, but not a lot. What is the purpose of adipose tissue? It provides a reserve supply of food for energy. It insulates against heat loss, and it protects organs. We wrote right here that we have a lot of adipose tissue around your kidneys and eyeballs, also around the heart, and that's to kind of cushion it against injury. So we've got fat tissue around the kidneys and eyeballs and heart to cushion them against injury. There's also fat adipose tissue under our skin. We vary in how much subcutaneous fat tissue we've got. Cutaneous means skin, sub means under. Some of us have more than we should, like me, but that's subcutaneous fat. There's also adipose tissue in the buttocks and breasts. In the buttocks, we've got adipose tissue to make it easier to, more comfortable to sit on a chair. Without the adipose tissue, it'd just be, skin and bones and muscles, and the adipose tissue helps provide some cushion. All right, so that's adipose tissue. That's a really easy one to recognize. On D11, dense fibrous connective tissue. And there's actually two types of dense fibrous connective tissue. This is really similar to a real or loose connective tissue, but actually simpler. Basically, all it is fibroblast cells that will be stained artificially purple and collagen that's been stained red. So there's no macrophages, there's no mast cells, there's no elastin. It's simply fibroblast cells and collagen. And we know collagen confers strength. Now, there are two types of dense fibrous connective tissue based upon how the collagen protein fibers are arranged. So there is dense regular arranged fibrous connective tissue, and there is dense irregularly arranged fibrous connective tissue. What's the difference? In regularly arranged, the collagen is running approximately all in the same direction. In the irregularly arranged, the collagen is running in all different directions. It's going up and down, side to side, swirling around. Now, when the collagen is arranged in one direction, it makes the tissue very strong in one direction, but not strong in every direction. When it's irregularly arranged, it's not real strong in any single direction, but it's relatively strong in all directions. Now, where do we find, let's start with the regularly arranged dense fibrous connective tissue. So where do we find it? This is what makes up our tendons and ligaments. So at the microscopic level, this is what a tendon or a ligament looks like. The collagen is what makes it really strong. You'd say, well, like, what's the difference between a tendon and a ligament if they're the same tissue? The difference between them is what they attach. TM. Tendons attach muscles to bones. Ligaments hold bones together. But they're basically the same tissue. What else is made up of this tissue? Same as a tendon or a ligament? Dura matter. We talked about dura matter? Yes. Yes, we have. You'd say when? Page E20. You'd say, you're kidding. We did that? Yes, we did. On page E20, which we covered last week, we said that there were these three membranes or meninges around the spinal cord and brain, and the outermost one is called the dura mater, a tough mother. And it is made up of the same tissue as a tendon or a ligament. And that's to protect the outer surface of the spinal cord and brain. That's called the dura mater. So it's the same tissue as a tendon. So the dura mater, that outer sheath around the spinal cord and brain, the periosteum, a protective covering around the bones, the perichondrium, a protective coating around the cartilage, fascia, a protective covering around muscles. All of these are made up of the same tissue, regularly arranged dense fibrous connective tissue. And again, the dermis of the skin and scar tissue are irregularly arranged dense fibrous connective tissue. There's two microscopes in the back. They've been out for like four or five times already, and they show skin. And you can see the two layers of skin on these microscopes. The top epidermis made up of stratified squamous epithelium, and the underlying dermis made up of irregularly arranged dense fibrous connective tissue. I like to use that on tests. You know why I like to use that on tests? Exactly. It's a twofer. I get to ask you two tissues on one slide, on one microscope. So make sure you look at them, and make sure you understand what it is you're looking at. Now, let me also try to clarify something that over the years I've found confuses students. So this is page D7, and it shows stratified squamous epithelium. Stratified squamous epithelium is a pretty tough tissue. It's got a lot of cells. That's what it's stratified. And it makes up our skin. Now, we know there's two types. There's the non-keratinizing and keratinizing. And the difference is whether it's on the outside of your body or inside of your body, like inside your cheek. So the stuff on the outside has got dead cells flaking off, And you can see on the slide, you can see the dead cells flaking off. And in addition, there's pigmentation. We talked about this before. In contrast, inside of your mouth, your cheek, that's also skin, epidermis, but all the cells are alive because they're surrounded by fluid. Saliva, they're not exposed to the air. There's also no pigmentation. Remember, the purpose of the pigmentation, the melanin, is to shield us and protect us from harmful ultraviolet rays. There's not a lot of harmful ultraviolet rays inside your mouth. It's on the outside when you're out in the sun. Now, remember that if this, all right, so this represents the skin, and the skin is really made up of two layers. The top is called the epidermis, the lower is called the dermis. We've been talking about what the epidermis is made of. The epidermis is made up of stratified squamous epithelium, either the non-keratinizing or the keratinizing type. The dermis is made up of irregularly arranged dense fibrous connective tissue. Okay, try to explain something. Let's I know you're impressed by my art. All right, now, I want to talk about the cheek of this person. Now, obviously, there is skin on the outside, right? And there's also skin on the inside of the cheek, right? So there's the skin on the outside of the cheek, outside of the cheek, and inside of the cheek. All right, now, let's talk about what the skin on the outside of the cheek is made of. It's made up of two layers. You'd say, what do you mean it's made up of two layers? On the very outside, there is keratinizing stratified squamous epithelium, and right below that is the dermis made up of irregularly arranged dense fibrous connective tissue. So in other words, there is an outer epidermis and an underlying dermis. All right, and we know that the epidermis on the outside is keratinizing stratified squamous epithelium, and the dermis is made up of irregularly arranged dense fibrous connective tissue. So why don't you feel your outside of your cheek right now? What are you feeling? You're feeling the epidermis made up of keratinizing stratified squamous epithelium. If you started to insert a needle, a pin, give an injection, you would go into the dermis. All right, and that would be made up of irregularly arranged dense fibrous connective tissue. Now, let's talk about the inside of the cheek. You can feel the inside of your cheek. Right? So what are you feeling when you're feeling on the inside? There is an epidermis and an underlying dermis. The epidermis on the inside of your cheek is non-keratinizing stratified squamous epithelium. Right? You can feel it. I got my finger right on my epidermis on the inside of my cheek, made up of non-keratinizing stratified squamous epithelium. If you gave an injection, and future dental hygienists will be learning how to give an injection, it'll go into the underlying dermis. So you might be saying, well, wait a second. You mean there's epidermis, dermis, and on the outside there's epidermis and dermis? That's right. And what's in between is muscle. In other words, you'd say, what do you mean there's muscle? Can you inflate your cheeks and deflate them? Well, there must be muscle there. So there is a layer of muscle between the skin on the inside of your cheek. There's muscle in the middle, and then the skin on the outside of your cheek. Do you follow? That's what your cheek is made of. So even though it's not that thick, it's actually got, going from the outside in, epidermis and dermis, that's the outer skin, muscle, dermis, and epidermis on the inside. You follow? And I only mention that because over the years, sometimes students have been a little confused. So on the microscopes in the back, there's actually a slide that shows this kind of skin and this type of skin, right? The skin that's got the pigmentation and dead cells, that the epidermis, and the skin that doesn't have the pigmentation and doesn't have the dead cells. All that the word epidermis and dermis mean is top skin and skin. Remember also they have different embryologic origins. The epidermis here developed from ectoderm. The dermis developed from the dermatome of the paraxiomesoderm. Now, interestingly, and I didn't emphasize this, the epidermis on the inside of your cheek actually is endodermal in origin, because that's part of your alimentary canal. That takes us to page D12. And on D12, we learned about cartilage. Cartilage is an unusual connective tissue. What's the unusual thing about connective cartilage that makes it different from all the other connective tissues? Wonderful, terrific, you got it. I underlined it right here, there are no blood vessels. And that's why cartilage doesn't heal very well. Cartilage is made up of, the cells are called chondrocytes, and the chondrocytes are really characterized by the fact that they are surrounded by a little pool of fluid called a lacuna, which means a lake. And these cartilage cells secrete various proteins that you may have heard of before, but anyhow, we didn't ask you to know it. Well, cartilage basically looks, and at the bottom of this page, D12, it shows 3 types of cartilage. Incidentally, another protein, you don't have to know this, but another protein you might have heard of that's in cartilage is glucosamine. So if you've heard of glucosamine, I mentioned chondroitin sulfate, you don't have to know those, but in case you've heard of those before. So anyhow, there's 3 types of cartilage: hyaline, elastic, and fibrocartilage. All 3 have chondrocytes inside of a lacuna or a little lake. The hyaline is the only one we asked you to recognize under a microscope. We talked about on D13 where it's found. Where is hyaline cartilage found? So on page D13, we said the embryonic long bones of the body start out made up of hyaline cartilage, and then they begin to calcify or ossify and become bone tissue beginning with the 8th week of development. And that continues through the whole embryonic development as a fetus and even after birth. Where else is it found? The front of the nose, not the bridge, but the front. And your trachea. You can feel your windpipe. You'll feel the cartilaginous rings of hyaline cartilage. And we said, don't worry about this thing. Whatever that is, I'll explain that later. Now, fibrocartilage, we said it makes up the intervertebral discs. So here's the vertebral column. And so these discs are made up of the second hardest substance in the body. The hardest is bone, and right after that is fibrocartilage, the toughest of the cartilage. The elastic cartilage makes up our ears, right? Very flexible. Obviously, it's covered by skin, but underneath the skin is elastic cartilage.